Hello, my name is Dr. Larry Arbeitman, and I want to thank you for clicking on this video. If you clicked on the video, that means either you or someone you really care about is a migraine sufferer or a headache sufferer. And migraine headaches are a debilitating condition. People lose valuable time with their families, days of work, have to take medications that oftentimes make them feel like a zombie, not knowing when the next one is going to hit. And over the next 3 or 4 minutes, I'm going to share with you what I believe to be is one of the best kept secrets in healthcare in helping people who are migraine sufferers. I'm an upper cervical doctor, and over the last 13 years, we've done over 120,000 upper cervical adjustments. And oftentimes when people go to the neurologist and get evaluated for headaches, oftentimes the treatments are based on just treating the symptoms without identifying the cause. Many times the cause could be coming from the neck or the cervical spine. Most people in healthcare these days think of the head and the neck as two different body parts. Like if you're having pain here, or here, how could it be possibly coming from the neck? But we know that the neck and the head are intimately connected. In fact, when there's a misalignment of the first vertebrae in the neck, the upper cervical vertebrae called the atlas, that little vertebrae can put pressure on or compress one of three structures. It can put pressure on the brainstem or the spinal cord, the delicate nerves that relay information to and from the brain. It can compress or put pressure on some of the blood flow to and from the brain. And it can even block cerebral spinal fluid, the fluid that bathes the brain. And if any of those conditions are present, that could be an underlying cause of migraine headache that oftentimes goes undetected by MRIs, CAT scans, and as an upper cervical doctor, we're one of the few doctors that are trained to detect and correct these minor misalignments. And over the years, we have helped so many countless headache and migraine sufferers with a gentle correction and restoration of the alignment of the upper neck. Now, one of the beautiful things about our type of care is there's no cracking, popping, or twisting. Everything is done super specifically and super gentle. We've adjusted little children all the way up to grandmas and grandpas in their 90s. And that's because when we deliver the adjustment, there's no more pressure than if you were going to check your pulse. None of that thrusting, turning, twisting, cracking, or popping. Now, the first thing that we need to do when we sit down with a headache or migraine sufferer is evaluate, do a thorough health history to find out their needs. Then we have to do a spinal exam and a neurological exam. One of the tests that we do up here on the computer shows how we can detect minor imbalances in blood flow and nerve flow in the upper neck. It shows up as color on these scans. After care, we expect that the pressure or the imbalances in the upper neck and the nerves are reduced, and that's what this clear test on the left shows. And in addition to relying on this sort of sophisticated testing, the upper cervical doctor takes very specific x-rays unique to this type of chiropractic. The x-rays allow us to measure the misalignment of the head and neck to 1/100th of a degree. This is sort of like developing a combination lock for your spine. That's what allows no two human beings to get the same exact adjustment. The x-rays tell us if we can help, and if we can help, how long. Now, this is a game changer for a lot of people. It makes me think of a story of a young man named Peter. Peter first came to our office as a student intern. He was a student at Monmouth University. He needed some extra credits, and one of our patients said, "Why don't you go shadow Dr. Arbeitman's office?" Peter was getting ready to go to medical school. Peter, after seeing how many headache and migraine sufferers were helping, brought up to me, "I suffer with migraines." See, Peter used to get migraines in the middle of tests. He used to have to go home, sit in a dark room, vomit for it to pass. He oftentimes didn't make social plans. He definitely didn't make plans for long car rides for fear that his migraine would hit while he was driving. Very shortly after Peter getting under care, his migraines had subsided. He totally changed the direction of his life. Instead of going to medical school, I'm proud to say that Peter is now halfway through the chiropractic program in Atlanta, Georgia, and is now going to pay this work forward to his community. And there's been so many stories like that through the years of helping people who suffer. Now, I don't know whether or not we can help you or your loved ones, but I do know this. if we don't get a checkup for our upper neck, we'll never know. And so what I'm going to implore you to do is fill in your information below. I'll have Samantha or Kristen or Stacy reach out to you, and we'll set up a time for us to have a conversation. I didn't say adjustment, and I didn't say you need care. I said a conversation to determine whether or not we can help you and whether or not the upper cervical misalignment is the cause of your problem. Or if you're really motivated, just pick up the phone right now and give us a call. And we look forward to seeing you soon and finding out if and how we can help.